Any pain?
Nope.
And right here, these are your clavicles, right above your supraclavicular lymph nodes. Any pain?
No pain.
No? Perfect. Do you have any questions?
No.
Okay. Okay, Dustin, so what I'm going to do next is I'm going to inspect your nose. I'm going to have you go ahead and look up. And what I'm looking for is a deviated septum. Okay, go ahead and look straight at me. And do you have any pain ever in your nose? No? Any
Nope.
drainage, swelling? No? Okay.
Nope.
All right. And then I'm going to go ahead and look in your mouth. Okay. And you have any issues swallowing food?
No.
Nope.
Not
Okay.
at all.
Good. So what I'm going to be looking for is any lesions, redness. So go ahead and stick your tongue out. Perfect. Okay, I'm going to be looking in the sides of your mouth. If I see anything going on, white spots, I'm going to go ahead and hold your tongue down and say ah. And your uvula is right in midline. That looks good. Okay, let me look up at the top of your mouth. Palate looks good. And then lift your tongue up. Perfect. I don't see any sores or anything that could look like a sign of cancer growing. Her teeth look great. No cavities. Do you have any loose teeth or pain in your teeth at all? No. Okay, good. All right. And then I'm going to go ahead and, oh, one more thing. I got to test your gag reflex, okay? Let me see it. Stick your tongue out a little more. Okay. There it is. Okay, so your gag reflex is intact. That's great. I'm going to go ahead and take the gloves off and wash my hands. Do you have any questions about that? You don't have any concerns? Okay. All right, so I'm going to go ahead and look inside of your ears.
Okay.
If you can go ahead and look this way. I'm going to pull up and out, and if I had an otoscope, I'd be looking in her ear, and what I'd be looking for is any drainage, redness, swelling. I would be looking for a damaged membrane, and then to see if the cones of light are present, and they are. That's good. So the right one would be at 5 o'clock and the left one would be at 7 o'clock. Okay, and then I'm going to go ahead and have you just put your arms out, okay, and bend your arms, cross your arms like this, put them back out. Okay, so does that cause any pain? Do you have any issues with moving your joints?
Nope.
Range of motion, good. Okay. All right, so I'm going to go ahead and listen with my stethoscope on the back side of the stethoscope, the bell of the scope, to see if listening for any swishing sound. So you're going to go ahead and turn this way. That'd be great. Face that way. Okay. So what I'm going to have you do is you're going to take a big breath in and blow it out and then hold.
Got it.
Okay, good. And you can just stay just like that. And I'm going to do it on the other side, okay? Big breath in, out, and then you're going to hold. Okay, good. So I don't hear that, and what I'm listening for is any brewery in the carotid artery, and I don't hear anything, so that's all good. Okay. And then I'm going to have you face me a little bit more straight on, and I'm going to have you look up. Okay, and what I'm looking for is the trachea here is midline. I'm going to go ahead and palpate. Go ahead and look straight again. I'm going to palpate right here. Does that cause any pain?
No.
Okay. All right, good. Okay. And then your wrists, can you move your wrists up and down? No pain? No? Okay. Let me just peek at your hands one more time. Go ahead and flip them over. What I'm looking for is any abnormalities, for any signs of osteoporosis or anything like that forming. Nope, looks good. And with your knees, can you go ahead and just bend your knee, put your leg straight out and bend fine? That doesn't cause any pain? No? Okay. All right. Great. Okay, so the next thing I'm going to do, Dustin, is going to inspect your eyes. Okay, so I'm going to look at your eyebrows, and they look nice and symmetrical. Go ahead and look at me straight, your gaze. Okay, and your eyelids don't look swollen. I don't see any drainage or redness in her eyes. The sclera of her eyes is nice and white, and that's healthy and what we want. And the pupils of her eyes are about 2 to 3 millimeters dilated. That looks great. The conjunctiva looks nice and clear. And I'm gonna look down underneath the gut. So go ahead and look up. I'm looking down the gut of her eye to see if there's any excessive redness, draining, anything that's like clogging in there. Do you ever have any pain in your eyes or excessive drainage or anything like that?
No.
Okay, great. All right, so the next thing we're gonna do is we're gonna test your cranial nerves, okay? So this one, when I have you do first, is close your eyes. Okay. And you are gonna, I'm testing your cranial nerve 1, olfactory nerve. Okay, actually, pardon me, this is 2, cranial nerve 2. Okay, so go ahead and smell and tell me what you think that is. Perfect, excellent. Okay, and then the next one is the ocular motor nerve. And what I'm gonna have you do is just watch this, Sarah, gaze at this pen. Okay, and about 12 to 14 inches from your face, and I'm gonna bring it into your nose and just follow it. Okay, perfect. And your eyes are going across, and that's good. That's what we want to see. Okay, and then the next thing we're gonna do is we're gonna dim the lights, and I'm gonna go ahead and test that. Sorry, is that it's too bright? The cranial nerve. Is your eye okay?
Yeah, it's fine.
Okay. All right. So I'm gonna go ahead and shine the light. And what I'm looking for here is to see if your pupils constrict. That's good. And then I'm going to go over here. And that's your trochlear nerve 4. Okay. And it looks good. It constricted from about 3 to about 1. Sorry, I made your eyes water. Are you
fine.
okay?
Yeah,
okay.
no, that's fine.
All right. Sorry about that. That's the worst of it, I think. Okay. And then go ahead and bite down for me and chew. Pretend like you're chewing. Okay. So that's the mastoid cranial nerve, and that looks like it's nice and intact. Okay, and then I'm gonna go ahead and just feel, there's a muscle right here, and I wanna have you go ahead and bite down really hard. Okay, that's the trimester muscle, and I feel a nice firm ball, and that's what you wanna feel, so that's nice and normal, okay? Okay, and then here, abducens, that's your cranial nerve 6. So what I'm gonna have you do is go ahead and look at this here, and we're gonna go ahead and have you look, follow this, okay? And try not to, just keep your eye steady here, okay? Perfect. Excellent. And so what I'm looking for here is any extra, like, involuntary movement of her eyes. I don't see any. So that's considered the field of gaze, and so everything looks really good, and I don't see any extra twitching or anything, okay? And then what I'm going to have you do is close one of your ears. And I'm going to whisper something, okay? And then you can repeat what you hear, okay? I'm testing your hearing, okay? Apples and bananas.
Apples and bananas.
Okay, so that's great. Let's do the other side. Puppy dogs.
Puppy dogs.
Okay, and that's the vestibular nerve, and that's intact. She can hear just fine. Okay. And then, do you taste food okay? Are you having any issues? Do you feel like you can't taste food?
No, not that I know of.
Okay, good. So the glossopharyngeal nerve is intact, and that's number 8. So, all right, and we already tested the facial nerve earlier. So, and you seem like you have a lot of function. So your sensory and motor is normal. Okay. And you said you play sports?
Yes.
Do you have any issues with that when you're running or anything like that? No?
No.
Okay, good. And then go ahead and do me a favor. Look at me straight on, and then you're going to tilt your head up and tilt your head down. Okay. And then you're going to look side to side. Look like this and like that. Your accessory nerve. Do you have any pain with that? No? Good. Okay. And then I'm going to go ahead and listen to your carotid artery. Okay, so you're going to look straight, turn this way. Perfect. You're going to take a big deep breath in and out, and then hold it. Now I'm going to go ahead and listen with the bell of the stethoscope, right side here. Go ahead, in and out, and then hold. Good, and I don't hear anything. And again, take a big deep breath in and out and hold. And what I'm listening for there is any extra like swishing sounds, a brewery, and she doesn't have one, so that's good. That's very normal, okay? And then what I'm going to do is palpate your pulse here, okay? Your carotid pulse. I'm going to just do one at a time. with 2 fingers, nice and strong. Probably a 2+ for her pulse.